I'm here with Tammi Byrd, who was one of the panelists at the 2013 ADHA Dental Hygiene in the Changing World event on January 12th, 2013. Tammi, thank you for joining us today.
My pleasure, Josh.
Could you tell me a little bit about your dental hygiene background and current role?
Well, I started dental hygiene in 77, graduated in 79, and I practiced clinically for 23 years. After we got some legislation passed in South Carolina, I went and met with our Department of Health and thought we were going to reopen public health dental hygiene. And when I found out that they weren't going to do that, I prayed really hard about it and said, what are we going to do? We've got law passed now that will allow hygienists to work in schools. How's it going to happen if somebody doesn't make it happen? And because of that, I decided to take a leap of faith and start a school-based dental hygiene program. And so I've been doing that. This is our 13th year now. And so I'm very excited to be serving a lot of children. And we've got 24 hygienists, 2 dentists, and 3 support staff now.
What do you enjoy most about your current employment setting?
I like it because it helps me see people. I get to look at politics, which I love. I've been able to stay active in the political arena, but it also helps me educate other individuals. I work with school administrators, I work with school nurses, I work with superintendents, and I'm able to educate them about dentistry, dental hygiene, what dental hygienists are, what we do. But it also is very versatile from a standpoint of me being able to work out of my house and travel when I want to travel and to make my schedule sort of fit my routine. I'm able to fit in things that I normally would not have been able to do if I'd been tied to an office from 8 to 5.
How can having a traditional clinical background be helpful in being an administrator?
You understand how an office works, what patient practice is, how you work with patients. You understand the clinical aspects, what will work, what won't work, the OSHA standards, the CDC infection control guidelines. By having a background in clinical, it makes me a much better administrator because I know what to expect, when to expect it, and know when there's changes need to be done.
What is the best piece of advice you can provide to others looking into being an administrator?
Have a business background. Find out about business. That's one thing I was very weak on, which I think most hygienists are, as well as dentists. When you start into a business, I knew nothing about payroll. I knew nothing about taxes. I knew none of that. And so if you're looking at starting a business and being in administration, especially if you're going to end up having to manage the money, manage the books, all of the other administrative portions of a business, you need to learn a lot about that before you jump into it. Also, computers. I didn't know a lot about computers when I started, and we do a lot of work with our computers. You have a lot of programs to run, and so just look into the business aspect of it because I think it's very enlightening and it will save you a lot of headaches when you start a business and make it much easier to adapt.
Well, and it sounds like participants can expect to learn a lot of great things at this event. Thank you, Tammi, for sharing with us today.
Sure. Thank you so much.